Welcome. It's my extreme pleasure to serve as a moderator for today's Ask an MS Expert webinar. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee, where I work to ensure that the perspectives and priorities of families affected by progressive MS are represented in all of the projects and work undertaken by the Alliance. I'm a district activist leader for the National MS Society, and I also chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today. People are continuing to join our webcast, so let's give them another few seconds and then we'll get started. And as we're getting started, I want to take this opportunity to acknowledge that today is an important day in our country's history. It's Juneteenth, a day to celebrate the end of slavery in the United States, commemorate Black history and culture, and reflect on the important work ahead to ensure equal treatment for all. Thank you for all of us who are joining us today on GoToWebinar, Facebook Live, and YouTube Live. Due to the large number of participants joining us on GoToWebinar, everyone has been placed in listen-only mode. Today's Ask an MS Expert webinar is one of a series of virtual opportunities the Society is committed to offering, so I hope you plan on joining us each week. Our objective in all of our Ask an MS Expert programs is to connect with you, share important information that you can rely on, and provide a forum for you to connect with experts on topics that are on your mind. So as I chat with our expert today, please feel free to post your comments and questions as they come to mind on Facebook and YouTube, or type them into the question box if you're joining us on GoToWebinar. I have a helper working behind the scenes with me today. Julie Fiol is ready and waiting to capture your questions while I'm busy talking. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. And I know many of you might have some very specific questions related to your own situation. Because of our limited time together, we're going to be focusing on the questions that pertain to everyone. And following the webinar, the Society's MS Navigator team will be standing by to address those specific questions that you might have. I'll be sure to let you know how you can reach an MS Navigator before the end of today's program. And if you're interested in reviewing today's conversation with our expert, this webinar is being recorded and it'll be available on the Society's website for reference. Over the past few weeks, the social unrest that we've seen in so many of our communities has focused our attention on racial injustice. That's a big subject that covers a lot of ground. And when you talk about racial injustice, the conversation has to include the topic of disparities and inequities in healthcare in America. So to get a better understanding of how the overall healthcare experience and health outcomes can be different for members of underserved populations, we're going to drill down to MS healthcare, and we're going to look at what research is telling us about the inequities in the delivery of healthcare, why it's important to address these issues, and the actions that we can take to fix the system. Today, we're talking with Dr. Jackie Batrai, a clinical psychologist and assistant professor of physical medicine and rehabilitation at Johns Hopkins School of Medicine, and a former National MS Society Multiple Sclerosis Research Fellow. Dr. Batrai's passion and her research are focused on studying racial disparities in multiple sclerosis care. Welcome, Dr. Batrai, and thank you for being with us today. You and I first met this past year at the National MS Society's Tyson Fellows Conference, which brings together more than 90 young research and clinical trainees to learn about each other's latest research efforts and to build collaborative relationships that tend to last for years to come. The conference featured presentations from established scientists as well as research fellows reporting on promising research that drives breakthroughs. And at the Tyson Fellows Conference, I learned about your research efforts that are focused on first gauging how the overall healthcare experience and health outcomes are different for historically underserved populations, and then understanding why and how factors like a person's neighborhood or income can influence their relationship with their doctor and the healthcare system as a whole. We had an opportunity to talk about this on the Real Talk MS podcast this past March, and I'm very happy to be with you today to raise awareness about a subject that demands not only more awareness, but greater efforts to eliminate these kinds of issues. I'm hoping you'll get us started by sharing what it was that made you passionate about reducing disparities and improving the quality of healthcare for members of underrepresented populations who are living with MS.
Hi, John. Can you hear me okay?
I sure can.
All right. Well, it's great to be here. And I got really passionate about studying disparities and particularly improving the health of underrepresented populations because of my experiences as an immigrant and a woman of color acculturating to this the Western world in the United States. I'm originally from the country of Nepal. My family and I immigrated to the United States when I was in about elementary school. And we came here for a better life, one that included better education, better health care, and all the above. Though, as I spent more time here, I realized that some of these inequalities that we experience in healthcare within our system eventually result in the people at the bottom experiencing as low quality of health as somebody in a lower resourced country like Nepal. So to me, that was quite surprising given the reason we came. And when I learned that these dynamics were present in the MS population as well, it really fired my passion to continue down this line. So
when we get into this topic, we run into several terms that are often used in discussing or looking at disparities in healthcare. Terms like health inequity, the social determinants of health, and healthcare by zip code. So can you tell us what these terms mean?
Yes. So there's some key terms we should talk about. Now there's so many that I'll just kind of focus on the major ones, and if we approach the others, we'll go over that. But the ones that you really touched on, so health disparity, health inequity, social determinants of health, I think those are really keys to our conversation. So as we know, health disparity or health inequality refers to the differences or you could say inequalities in health status or health quality in general. Health inequity is a little bit different, and that distinction is really important. So the best way that I know that I can explain this is, if we want equality, we want to give everyone the same thing, the same equal healthcare, same equal opportunities. If we want true equity, health equity, then we have to kind of modify what we provide to certain populations based on the need, the historical context of society. And so sometimes this does involve putting more focus on certain populations over others, particularly those that are vulnerable. So this difference between equality and equity is really, really important. And then social determinants of health, that falls right into this discussion. Social determinants of health are factors that have a huge impact on our health. The healthcare system is only one piece of that puzzle. Social determinants of health include things like our neighborhood, the food available, healthy foods in our neighborhood, transportation, access to healthcare appointments, among several others. And these are very systemic structural factors, right, that have been built into our society that can have a huge impact on people's health. And so when I talk about health equity, we want to make sure that we have our health system and our society set up in a way that everyone succeeds. So those having barriers and experiencing barriers to social determinants of health are provided those opportunities and resources, whereas others may not need those resources. So and yeah, those are kind of the main ones. Yeah.
I'm wondering if you can share some examples of health disparities that people living with MS might find themselves faced with.
Yeah. So, with respect to MS, there's disparities that exist that we know exist across many patient populations, right? So one thing is access to healthcare. There's studies that show many patient populations, including people with MS, have less access to healthcare. And this goes into kind of the social determinants of health conversation I was talking about, whatever reason that may be, due to cost, due to access to transportation, any of the above. The other thing is that when people don't have access to those routine healthcare visits, they're more likely to present in, for example, the emergency room, right? And that's where the costs can get driven up. In addition to the access piece, another really important example in the literature is for people with MS. The data shows that specifically Black or African American individuals experience worse disability or more rapid disability progression compared to their white counterparts. And what I think needs to be done in the MS literature is more research on why that may be the case. Right now, we know that some of these disability and neurologic disparities exist, but we want to learn more about why they exist.
I'd like to talk about some of the factors that contribute to these kinds of disparities. And I want to talk about the term white privilege. It's a term that we frequently hear, especially lately, and I'm sure that everyone has their own thoughts about what it might mean. But in terms of access to healthcare and healthcare delivery, does white privilege exist? And if it does, what does it mean?
John, you're touching on a topic that is a very common conversation in my household. So white privilege refers to, in general, societal privileges that benefits white people over people of color in any particular society. And within the US, it's white privilege takes a very invisible form, I would say, for those with the privilege. And I know this is sometimes a struggle to understand because, one, due to its invisibility and the fact that it is built into our structural systems, but also we know that there's many people who with a white background who may not see themselves as having privilege because they come from lower SES or whatever that may be. And so I think the key piece there is that solely due to people's color of their skin, the fact that they are white has afforded them these privileges that act in invisible ways throughout the history of the United States. And that privilege then continues to benefit them down the line in a way that people of color do not have a benefit. So I'll give just one basic example so that can kind of elucidate this invisible phenomenon. During, in the 60s, 70s, as the dream in the United States was to own a home, right? Like the family dream was to have a house and raise your kids and a family. And the government gave out loans for white families so that they could buy a home, right? Homeowner loans. And they did not provide these to Black people, they were not approved for these loans. And so, owning a home is this piece of equity that American families had. Some had and some didn't. And so down the road, these inequities come about. And it's just very hard to see given that they're so structural. And yeah.
How would you measure the effect of white privilege when it comes to something like accessing the healthcare system?
Excellent. That's excellent. So with respect to how it can contribute to these healthcare disparities. So with respect to, I think about it in actually the patient-provider relationship as well, and access, right? So if our society has kind of built within it this white privilege systems and dynamics, there's so much research that shows that providers, regardless of race, are more likely to believe that their patients of color, specifically Black or African American, may not adhere as well to medications, or, in the case of MS, may not be as knowledgeable about the disease modifying therapies or treatment. And then that ultimately affects the decisions that healthcare providers make. And this could just be based on our perception or our initial thoughts that we might have about a certain group, And so as a white person in the United States, I think what the data very overwhelmingly shows is that you're given this benefit of the doubt, even within the healthcare system, by people who are not doing this intentionally. But they give you a benefit of the doubt, and you are more likely to get better quality of care and have a better relationship with your provider if you are white.
Well, I have to say, I'm really pleased to see more research being done in this entire area of healthcare disparities and access. Why do you think this topic has gained growing interest from researchers?
Yeah, so this is a good question, especially at the current day and age, John. So this is really important. One, as a collective effort, our country can only be as strong as the people at the bottom, right? And so I see things as a very collective effort. But in terms of just the data, the United States spends more money on healthcare than any other developed country. However, people at the bottom are experiencing quality of healthcare that's as low as the lower resourced countries, the ones that my family and I came from, which, given how much money we spend, should not be the case. And so, in essence, I think this collective effort of our country is as strong as those at the bottom. We've got to take care of the entire group for all of us to succeed, if that makes sense.
Yeah, I think that really makes the argument for why this is so important. Let me ask you kind of the flip side of that question. What's the impact of not addressing these issues when it comes to the delivery of MS care?
A really important question. There's many impacts that can happen, and we've seen these across patient populations where they haven't been addressed. So some of these, they include obviously worse health status and worse health status for those underserved, those who are not being served maybe as well or at high of quality as those who are being served in terms of MS healthcare. Also, these disparities are going to continue to widen or at least stay the same, which, as I said, the larger the disparities, regardless of how much money we spent, we're still going to have people at the bottom with severe, very low quality of healthcare. So these disparities will continue that. And then another thing in MS is addressing these issues in MS is so important because a lot of the treatments exist. They're tested in clinical trials with largely white samples, right? And so I can't tell you how many of my patients I'm thinking of the differences between my white versus Black or African American patients, and who chooses not to go with the disease modifying therapy that's recommended because of the adverse effects they experience. You got to weigh the pros and cons. And so if these medications are not being tested in a certain group of people, we can't speak to some of these adverse effects. And so patients are left making these decisions on their own, based on their experiences too. So I think it'll be really important if we want to care for everybody with MS and not just a particular group.
Now that we've looked at disparities in healthcare on sort of a macro level, I'd like to take a deeper dive and look at what the research is telling us, and specifically what you're learning from your own research on the subject. Before we get into that conversation, I just want to take a moment to welcome those of you who have continued to join us on GoToWebinar, Facebook Live, and YouTube Live. Please let us know what's on your mind. Post your comments and questions on Facebook and YouTube, and type them into the question box if you joined us on GoToWebinar. By the way, our Ask an MS Expert live event takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about this event and future events with your family and your friends. Some people have asked, what evidence is there that demonstrates these disparities in healthcare delivery and outcomes among members of underrepresented populations who are living with MS? So let's talk a little bit about the research. And I'd like to start with what we already know. Some of our viewers want to know if MS affects African Americans and Hispanic or Latino populations differently. I know you just touched on that briefly a moment ago. Teresa is asking if it's true that Hispanics and African Americans generally have a worse course of MS. And Malcolm wants to know if the incidence of MS among African Americans is different than the general population. So what does the research tell us here?
Yeah, and so like you said, I kind of touched on this, but more specifically, the literature, it does show that these underserved groups experience substantially worse neurologic outcomes. And when I say neurologic, I mean disability with respect to like how much disease burden with MS, greater brain lesion volumes, increased involvement of the spinal cord, which then leads to difficulties with ambulation. All of these difficulties lead to earlier death of up to like 10 years greater than compared to their white counterparts. And like I said, also higher healthcare costs. So in terms of the incidence rates for African Americans and the general population, so this is slightly newer evidence, and we found that we and many other researchers have so far found that Black women with MS actually have the highest rate, which is not what was traditionally believed within the MS population. But for every, let's say, 10,000 Black and white people with MS, there's 10.2 versus 6.9 for Black versus white people with MS incidence rate.
That's a huge difference.
Yeah.
That's a big difference, and it's sadly ironic. There was a time when so many people believed MS was a white person's disease.
And it's that's such an important point, because I think, John, this is a hypothesis based on the data that I'm making, but I think that because of that belief, which can still lingers around, is that I think that we may not recognize MS symptoms as maybe as clearly when we as providers see Black people with MS, or we may attribute it to other things, or even individual like Black or African American individuals may experience these symptoms and may not think that it's MS related and something else, So I think that is having consequences down right now. So
I think you're absolutely right. And it's another unfortunate aspect of everything you're sharing is, although you're talking about the effect of these disparities on health, that ripples through. Somebody who has a disease course that's worsening more rapidly is someone who is going to be economically penalized for that as well. Either they may not be able to work quite as the same way as they used to. They may have a family caregiver who is going to be taken out of work in order to support their needs as their disease worsens. So this tends to impact not just the patient, but the family. And of course, the most profound impact is people who are in underserved populations that are dying 10 years sooner.
10 years.
That's startling.
Yeah, very startling. It's devastating, to be honest. It's devastating. These disparities have been around for so long, and one thing I am grateful for is that the attention on this topic has increased due to recent social unrest. And although I'm devastated about these things happening, obviously, the attention that I think it's bringing in various sectors of society, that is good to see this time around. I think it's a little more than the usual.
Well, let's talk a little bit about your research. Can you share what your research is about and what you're learning?
Yeah. So so far we've learned some findings between Black and white people with MS related to mental health symptoms, and some of which I've shared with you already, John. And then I'll kind of share a little bit about what else I have going on. Given the recent rapid rise of COVID-19, the research has been put on hold, unfortunately, but we're hoping to rev things back up soon. So in terms of what we do know, based on the research, a specific study that I talked about previously looked at socioeconomic status and MS and race and depressive and anxious symptoms. And what we found was that for people at the top of the income quartile, so we divided people's incomes in four groups, and those at the top 25th percentile had similar anxiety symptoms, despite whether they were Black or white. So there weren't any big differences there. However, when we looked at people at the bottom of the income quartile, looked at the differences between Blacks and whites, we found that Black people continued to have higher rates of depression at the bottom compared to white patients, also at the bottom. So this, it's not too surprising, given that, the anxiety symptoms, if you have the resources, if you're at the top of the income quartile and you don't have to worry about, for example, having food on the table that night, you're probably going to have maybe less things to be anxious about, right? But so at the bottom, though, why are we seeing the difference in these depressive symptoms? And so a lot of research points to that these depressive symptoms continue despite SES, just because of all the other structural racism that exists in our society. And did that cover your question?
Absolutely.
Yeah.
Tell us a little bit. I understand it's on hold at the moment, but soon we hope it won't be.
Yes.
What sort of things are you working on now?
Yes. So right now we are actually working on a multi-site study, getting this started between our MS Center at Johns Hopkins, as well as the MS Center at WashU in St. Louis, Missouri. And we wanted to actually get data from we are getting data from Black and white people with MS at both sites to look at potentially site differences as well, being in Baltimore and St. Louis, and look at differences in quality of healthcare. And we're going to measure quality of healthcare given at these MS centers based on what's in the medical record. So what the provider documents, what the patient does or reports in the note. So it's all going to be based on what's been documented within the patient medical record as just one step, as one way to learn about this. The second part of this study will be to actually get the patient perspective of what their experiences with healthcare quality has been like. Because when we look at the medical record, we're largely focusing on what the provider is reporting, right? And so the second piece will be focus groups and individual interviews to talk to these Black and white participants, patients with MS, about their experiences with MS healthcare.
What do you think needs to be investigated further to develop interventions that eliminate or at least mitigate some of the disparities we've been discussing?
Yeah, so in order to eliminate disparities, there's a three-step process, right, to eliminating disparities. First is we got to detect what's out there. And so that's kind of been underway in MS. And then we have to develop these interventions, but we have to know what these interventions are made for. Why should we make these interventions? And so I'm hoping that based on what we learned from patients and providers about healthcare quality delivered to Black and whites with MS, it'll elucidate areas where we can focus future interventions on, what we need to work to improve. Because right now there's a lot of unknowns that remain.
What else do you think can be done to mitigate these issues? And maybe more importantly, what specific action can each of our viewers take?
Yeah, so that's a really good question. I think that the biggest thing to progress the medical and the science of MS is the research piece, right? And to try to be active participants in research as much as like possible, and so that we can learn more. And we need to see more underrepresented people in MS research. So I don't want to word this in a way that sounds blaming, like we need more underrepresented populations to be participants. That's not what I'm saying. I'm saying like these efforts also need to be on part of the researchers and the providers at these institutions who are doing these studies. We need, as researchers, of course, we need to make more efforts to recruit these individuals. And then, yeah, so I think it comes from both ends, the researchers as well as the people with MS. Another thing I think of is if you are someone who has the resources to be able to participate in these studies, and talk to your provider about what the study will entail, and it's spreading the information you're able to understand and receive because you attend these appointments is, I think, a really great everyday way to be able to provide that information to those who may not have the same resources you do. Another thing I think of is as patients, right? As a patient myself, I do this with my provider. So I only would love to welcome this from MS patients, but it's to think about research studies that are going on and how can they be modified or even expanded in a way that people who don't have as many resources could still participate. So for example, through telemedicine platforms or whatnot, if the transportation is an issue there. I think just thinking about things like that and asking our providers, so what if someone doesn't have the ability to come in? Like, is there a way you can participate in from your home? Things like that. I know that may not be possible in all situations, but I would very much welcome that. So thinking about things in that way. Yeah.
Well, thank you for sharing your expertise with us. Now I'd like to focus our time on addressing more of the questions that our audience has for you. Christina says, my mom has MS and speaks Spanish, and she struggles with communicating with her healthcare providers. What suggestions do you have to help her?
Yeah, that's a good question. One that we see come up a lot. So, kind of depends on what resources are available in the context of the healthcare system your mom, Christina's mom, is in, right? So, I know that at Johns Hopkins we have what is trans interpreters. Who should be available, even if it's just by phone, to be able to be in that visit, right? So that we can communicate. However, I know that that's not possible in all medical contexts. And so I think, again, I point the responsibility back to these providers, these systems, and the healthcare systems to make sure, if we don't have interpreters in place, what resources are in place for people who may not, like, English is not their first language. Yeah. And so either asking the providers about what resources are there so that I can be paired with a provider who may know this other language, or another provider in the community who they could communicate with better. So doing what I think, as patients, we really have to be active and ask our providers for what resources are out there, So I want to put a lot of responsibility back on the providers, but ultimately it falls back to patients too.
Denise wrote in to say that she doesn't think she's experienced health disparities, but Denise attributes that to having good health insurance. How does having a good health insurance plan impact someone's care?
Yes, that's an excellent question. It's good to hear that you're not impacted by the disparities. I think a big piece of that is having health insurance that can help cover the costs of healthcare, especially given that some of these MS disease modifying therapies can be quite pricey. I also want to point out the social determinants of health that we talked about, right? So if someone does have access to, or if someone does have health insurance that covers their care, the chances are that they more than likely have a way to transport themselves from their home to their appointment as well, right? And I don't want to make assumptions. It could be different for everyone, but with the health insurance comes other resources that probably have to be in place. And so that's a big part of it. And I think there's many other social determinants that can also come into play there.
Marcus wrote in to say, my sister is depressed and anxious, but people in our culture are not comfortable seeing a doctor for these types of health problems. What can I do to help her?
Yes. So this is another thing that I think impacts the lack of representation of underrepresented people in MS research, is the mistrust that might be there for certain populations, and particularly with respect to psychological symptoms, right? And so I think that with respect to what can be done, I think talking to your MS provider about these symptoms and what referrals might be in place, and especially referrals for providers who share a similar background with the person. And I say the similar background because there's so much research that shows that people of certain racial groups, ethnicity backgrounds, are more willing to see a provider who they share that characteristic with. In addition to just provider, period, I think that looking at resources that are available in the community. So this experience, right, of not wanting to see a doctor for this kind of symptom it's shared, unfortunately, among many groups of people. And so having community supports, whether that be a religious organization, some kind of social group that gets together, can also be kind of a way to connect to these types of services without it being directly going to a provider who provides those services.
Say, Julie, can you pop up and bring along some questions that you fielded while we've been having our conversation?
I sure can. This has been a great discussion. Dr. Batrai, there have been several questions coming in for you, and some people just sharing their own personal experiences. So I'll read some of those to you and let you comment. We've heard a bit from Deborah. She says, hi, my work connects me with people in prison, and I have seen some horrific inequities in the treatment and violence experienced by incarcerated people with MS. For example, DMT treated, so disease-modifying therapy, treated as a reward for good behavior, violence from COs, I think that's correctional officers, to punish lack of bladder control, etc. Do you know of anyone working on the rights of incarcerated people with MS? This needs to change. And I read this not because I expect that you to know of the advocacy groups addressing this, but this is another, I'm assuming, another underserved population. How do health inequities affect those who are incarcerated?
That's a great question. I wish I had the answer to that, but I can just give like a general background of how our prison systems reinforce these health disparities. So I'm sure this applies within the MS population, you know, to some extent, but I think the biggest startling thing about this is that right now in the United States, we have more specifically African American men in prison than African American men who were in slavery, you know, several hundreds of years ago. I mean, like that just to start, I think is just a shocking fact that shows where a lot of these disparities can originate. And then you see these people in the prison system that experience the treatment that Julie, that you're describing, and those which can certainly lead to disparities. And I think that in prison, if we're in that kind of environment where our health is not prioritized or we're rewarded with medications and treatments, you know, that has a really adverse impact on health. And once that person goes out in the community, there's that much more almost to make up, right? Or yeah, that's as much as I can speak to that. That's
we've also heard from Cheryl, and Cheryl says she's a 61-year-old Black woman with MS. She visited a neurologist in 2002 with a major MS symptom. He didn't appear very interested in my complaint, MS hug, and simply said I was getting old. 4 years later, I was diagnosed. I believe if I wasn't Black, I might be walking today. If he had considered that a Black person could have MS, he made me feel as if I was making up the symptom. So Cheryl's not really asking a question, but I wanted to read that because I imagine, unfortunately, many of our viewers can relate to Cheryl's situation, but you touched on incidence of MS and how more recent studies are suggesting that the incident rates are higher in the Black population. And so the significance of, what is the significance? I'll pose that as a question to you of that incidence rate, and how might that help people like Cheryl?
Yeah. So I think that, like I was sharing with John, that this is a newer evidence. And so newer evidence that Black women specifically, there's a higher incidence rate. And but I think we have to get past that belief of that MS being like a white person's disease, you know. And so again, I'm going to put responsibility back on like the organizations, the providers, healthcare systems with resources to further educate and disseminate these kinds of data. I think this is something the National MS Society also does really well, is disseminating up-to-date information. So in terms of providers, I think this is why the staying up to date on the research is so important. And as a patient, if you know more up-to-date research that maybe your provider does not, which as a patient, I have very comfortably done that with my providers. They may not like it, but as a patient, it is your right to tell your provider, look, I read this on the internet. Is, you know, do you know about that? And maybe they do know, but it's not on the forefront of their mind. And so to really advocate for yourself as much as you can in that regard.
Yeah. We heard from another viewer, Carla, and Carla says, why are they only talking about Black and white? What about people of other colors? So if we've been focusing a lot on Black and white disparities in care, or disparities for people who are Black and white, what can you tell us about other like Latin, Latino, Hispanic? We've talked about what terms should we be using. So could we expand our conversation a little bit more?
Yeah. So that's other groups, other underserved groups are very important to also mention here. That, and I didn't get to do that yet. Thank you, Julie, for bringing that up. I think that like in the MS research, the largest set of data that do exist are Black-white disparities. So an area important for future research is that we focus on these other underserved groups. That includes the Latinx community, and as well as the LGBTQ community. We know there's some research that shows again, like the adverse impact, or not, I shouldn't say the impact of having that background. I should say the disparities that exist in healthcare for these underserved groups are largely consistent with what we're seeing with the Black community, but I would say like we need way more research on that to be able to speak more specifically to that. One thing I do want to mention is this piece of intersectionality, right? So it's not always Black and white. Like you're saying, there's many pieces of one's identity that can contribute to the kind of healthcare they receive, one of which being like if it's another race, if it's like sexual orientation, gender identity, whatever that may be, these lead, and sex, male or female, you know, I should mention that the most basic, yeah. These compound the adverse impacts that these certain underprivileged status can have. And so we really need to keep that in mind, that it's not always this Black-white dynamic that's largely covered in the literature, that people have many aspects to their identity, and sometimes the effect can be compounding in various ways.
So I might have missed this if you and John were talking about it, but a few weeks ago on our program, we had Dr. Mitzi Williams, and she talked about some disparities just in our current COVID-19 pandemic and treatment and access to care for people of color. Sally wrote in with a question wanting to know, how has the pandemic affected MS care for those who are unable to afford telehealth options? So I'd love to hear you talk about that, and if there's anything that we haven't discussed that we should be talking about in terms of disparities in treatment for COVID-19 for people of color.
Yeah. So I'll talk about the telehealth piece first. So I can speak to my experiences with my patients. In fact, so right now, the patients with MS that I see, I'm seeing solely through telehealth platforms. And I actually, and just my group, our experiences have been that it has actually increased some access for patients, especially those who may live far enough to where transportation was an issue to get to appointments. And so now we can do this through a telehealth platform. What we've also found is, so insurance is now covering telehealth platforms, which is great. It varies by insurance and it changes very frequently. So it's something to always keep up with. but insurance is also covering telephone visits, which is really great. So people with a phone that they can dial into their provider are now able to go to visits, which if any of the other barriers are in place, I think that actually this has increased access, given that people have access to a phone and or smartphone for video conferencing platform. That makes sense. And then you asked about COVID disparities too. So we look at the history, right? We look at the history of any type of like pandemic or outbreak like this. Who gets affected the most negative, the worst? It is the most underserved, underprivileged groups who get impacted the worst. And we're seeing that right now, largely with Black or African American individuals. I mean, just the most recent data I looked at in like local Baltimore, Maryland area is the disproportionately higher rate of COVID among the Black population, and then like the adverse outcomes with COVID. So things like death, just it disproportionately impacting Black and African Americans higher. And also, I read something about police reports and who was cited the most for not socially distancing appropriately. So this is actually specific to New York, but it was African Americans, Blacks, who got the most citations for not socially distancing. But so like before we can talk about that, I mean, we have to look at the context of the situation, right? So it's also Blacks and African Americans who are more likely to have hold the essential job positions where like you have to go into work, you have to be people facing. And then maybe that requires you to take public transportation or whatever it may be. I think there's so many different factors that impact one's ability to socially distance. So before we can, report this stat like I just reported without like putting blame on the people themselves, we have to look at the context and all the other determinants in one's environment. And one last thing I will say is given the social unrest and all the protests with the Black Lives Matter movement right now, I think this is just another example of how the disadvantage of certain groups can really impact their health. So we're supposed to be socially distancing, right? And these protests, it's hard to socially distance. That's what a protest is. And a lot of the time I hear these criticisms, on TV, but people who support the Black Lives Matter movement, which I am one of those, and I would say, there's like two pandemics. There's racism and there is COVID, right? And so some people don't have the privilege of socially distancing and staying home because they're also fighting with this racism piece. And so, I know that we're seeing a rise in COVID rates, and how much of this is directly related to protests, I don't think we'll ever know directly, but I do think that there's going to be an increase largely as a result of everyone coming together. But yeah.
I might have time for one more question. John, do I have permission?
30 seconds, Julie.
We said we wouldn't do that to Dr. Batrai. So 30 seconds. We have a question that just came in recently to the question box. This is another one from Deborah, and she's asking if there are any data on trans women and MS. Nothing more specific from that. I'm not sure if you're aware, but if you now I've taken up 15 of your 30 seconds.
So I'll answer that in very few seconds. Right now I'm not sure off the top of my head. I would need to look into that, and if it is there, it would be more recent data on trans women with MS.
Well, thank you for popping up, Julie, and thanks to all of you who submitted your comments and questions, and thank you, Dr. Jackie Batrai, for being with us today.
Thank you, John. It was a pleasure to.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on to be current, up-to-date, and credible. First off, you can always check the National MS Society's website at nationalmssociety.org/COVID-19 for complete updated information on COVID-19 and its impact on people living with MS. I'd also like to acknowledge that we're in the midst of an emotionally difficult time for so many people. And I want to make sure that you're aware of some resources that are available if you find yourself in emotional crisis. The National Suicide Prevention Lifeline is available 24 hours a day, 7 days a week. They offer free and confidential support for people in distress, as well as suicide prevention and crisis resources for you or your loved ones. And you can reach them by calling 1-800-273-TALK, 273-8255. The National MS Society's MS Navigator team can connect you to support groups and other support resources that can also help. And I want to circle back to something that I did say earlier. If you were unable to get your questions answered today, please know that the National MS Society's MS Navigator team is available to answer those questions, and they'll connect you to the very best resources. I'm going to share all the ways that you can connect with an MS Navigator in just a moment. For more information on Dr. Jackie Batrai's work and her published articles on this topic, please feel free to visit the Johns Hopkins School of Medicine website at hopkinsmedicine.org. And you can also follow Dr. Batrai on Twitter, and I think you'll see her Twitter handle right on your screen. Every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you'll find a few minutes to give Real Talk MS a listen. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Pandora, or wherever you find your favorite podcasts. Now, I promise that we share all the ways for you to contact an MS Navigator with your questions. You can find them on the MS Society's website at nationalmssociety.org. You can contact an MS Navigator by phone at 1-800-344-4867, or you can email your question to an MS Navigator at contactusnmss@nmss.org. You can also connect with the National MS Society on your favorite social media channels, including Facebook, Instagram, Twitter, YouTube, and LinkedIn. And when you do, please make sure to like those social posts and subscribe to those channels. And you want to make sure that you get on the Society's mailing list by signing up at their website. That way you'll receive regular updates on upcoming programs and the latest information on MS treatments, research, and how to live the very best life with MS. I'd like to thank Dr. Batrai for sharing her knowledge and insights with us today. And I'd like to thank everyone who's joined us today for your great questions. Please remember that a recording of this webinar is going to be available for your review at the Society's website at nationalmssociety.org/MSExpert. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey only takes 1 minute and makes a huge difference. So please take that minute and fill it out. On behalf of Dr. Jackie Batrai and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.